evening. So today's video is on eczema and psoriasis. So what is eczema? Eczema, also known as dermatitis, is a common non-contagious skin condition which affects children and adults. So there are a lot of different types of eczema which vary in severity, but the basic symptoms are always similar for this. It's either dry and itchy skin, which can also become red and sore. So the most common type of eczema is atopic eczema, which tends to affect people who have allergic conditions like asthma, hay fever. Other types include contact dermatitis, where the skin reacts to an irritant or allergen, and seborrheic dermatitis, which tends to affect the face. So, many symptoms of eczema. So, people with eczema tend to have skin that is chronically dry and unable to retain moisture, making it sensitive to infections and irritation. So, if a patient has atopic eczema, they'll have areas of skin that are itchy, dry, cracked, sore. Eczema normally develops on the hands, the insides of the elbows, and the backs of the knees, although it can affect any area of the body. With regards to children, it commonly affects the face and the scalp. So complications of eczema include skin infections. So this happens, you can get the following symptoms, which means you should probably see a doctor as soon as possible. So your eczema gets worse, a yellow crust or yellow-white spots on the surface of the affected skin. Fluid is oozing from the skin. Your skin is sore and swollen, and you feel feverish and unwell. So I mentioned before about atopic eczema. So this doesn't cause bad symptoms all the time. Usually what you'll have is flare-ups during which your symptoms get worse. Then you have periods when your symptoms improve. These flare-ups are usually triggered by exposure to an allergen or irritant, hormonal changes or environmental factors. So other types of eczema can cause slightly different symptoms. So seborrheic dermatitis, for instance, causes dandruff and it affects the scalp. So an interesting question is, who can be affected with eczema? So it's a very common condition, especially atopic. So it's thought to affect 1 in 5 children and 1 in 10 adults. So you're more likely to develop atopic eczema if you have one or more close family members with it. So moving on to psoriasis. So this is a condition that causes patches of red, crusty and flaky skin to develop on the body. The most common type is known as plaque psoriasis. This is where affected areas of the skin develop in large patches marked by a clear outline. Psoriasis is caused by the body producing too many skin cells. Normally, skin cells are replaced every 3 to 4 weeks, but in people with psoriasis, the process happens every 3 to 7 days. The build-up of skin cells is what causes the plaques to form. So, plaque psoriasis can cause areas of red and crusty skin to develop across the body. This normally occurs on the elbows, knees, scalp, and lower back. These plaques are often covered in silvery scales, and sometimes they might be itchy and sore. In more severe cases, plaques can crack and bleed. Other types of psoriasis affect specific areas of the body, such as the nails, or cause different skin symptoms. There's another type of psoriasis called diffuse psoriasis, which causes small drop-shaped sores, while pustular psoriasis causes pus-filled blisters. So who does this affect? So it's thought to affect around 2% of the UK population. It can be at any age, but it's more likely to develop in adults under the age of 35. So currently, it's not really clear why people have dots are more susceptible to it, but it does run in families, so it is genetic. So comparing the appearances of eczema and psoriasis, as mentioned before, eczema usually appears as areas of dry skin, which can be itchy, dry, cracked, sore. So depending on the skin colour, your eczema can be red, brown, dark brown or grey. Psoriasis usually causes distinct areas of dry and crusty skin, which are often red with a ragged but clearly defined border. Plaques are often coated in silvery scales. Eczema is characterised by very itchy skin, which leads to constant scratching. Scratching can in turn cause inflammation and bleeding and makes your skin more vulnerable to infection. Whereas psoriasis can cause itch and soreness, but this doesn't happen for everyone. Eczema can also occur anywhere but tends to develop on the fingers, inside the elbows and behind the knees. It can also develop on the face and scalp in children. Psoriasis tends to develop in similar areas to eczema, such as the elbows and the knees, and it's also quite common for it to affect the lower back and the scalp. So managing these conditions. So eczema can't be cured, but it can be managed with daily use of emollients, moisturisers, and the occasional use of topical corticosteroids when symptoms worsen. Emollients are particularly important as they help keep the skin properly moisturised, which helps protect it from irritants, allergens, and infections. As well as that, you can try other treatments such as calcium urine inhibitors like pimecrolimus or tacrolimus for use in sensitive areas, antihistamines to combat severe itching, and bandages or wet wraps to prevent scratching and moisturise and heal the skin. With regards to treatment for psoriasis, this also can't be cured like eczema, but the symptoms can be managed right. With similar treatments to the eczema, and these include emollients for use all over the body and topical corticosteroids for use in affected areas. You can also get prescribed vitamin D analogues, which can be used alongside steroids. Also, calcium inhibitors like pimecrolimus and tacrolimus for use in sensitive areas. Coal tar, which can be used in combination with phototherapy, and diaphragm. So, as well as topical treatments, psoriasis can be treated with phototherapy, where natural and artificial light is directed at the affected skin. Another option for severe psoriasis is a systematic treatment such as methotrexate. That's the end of today's video. I hope you've enjoyed that. And then for the next one, thank you. Bye bye.